right. The NHS is one of Britain's proudest achievements, and it operates across the whole of Great Britain, and cooperation is ingrained in the DNA of the NHS, and I am absolutely determined, as the UK Secretary of State for Health and Social Care, to make sure that wherever you live in this United Kingdom, you can access the very best of care. So if a constituent of my honourable friends in Aberdeenshire needs a treatment that is only available in England because it's so specialised, then they should have absolutely every right to that treatment, in the same way that a constituent of mine in Suffolk, or indeed of my honourable friends in North Wales. We have one NHS across these islands, and it's one of the things this country is most proud of.
Let's go to SNP spokesperson, Dr. Philippa Whitford. Philippa.
Thank you, Mr. Speaker. I'm sure the Secretary of State is well aware that the Scottish NHS has been separate since 1948 and has been under direct Scottish Government control for the last 20 years. So there's actually 4 NHSs. Perhaps I can ask the Secretary of State about some of his decisions that have made it harder for the Scottish and other devolved governments to fight COVID. Last September, he refused to follow sage advice for an urgent lockdown, and the 6-week delay allowed the more infectious B117 Kent variant to emerge and spread across the UK, driving a second wave more deadly than the first. He has repeatedly claimed to follow the science. So can he explain why he didn't follow scientific advice last September?
Thank you very much, Mr. Speaker. Just on this point, this attempt at division within the NHS is deeply regrettable. Deeply regrettable. It's not what people want. It's not what people want in Scotland. It's not what people want anywhere across this country. The NHS is an institution we should all be very proud of. Of course, it is managed locally. It's managed locally across parts of England. It's managed under the devolution settlement in Wales and Scotland, and health services in Northern Ireland, rightly so. But it ill behoves politicians to try to divide the NHS. It is a wonderful institution that should make us all proud to be British. On the specific second question she asked, of course, we are guided by the science and take all factors into consideration. These are difficult judgments based on uncertain data, and we make the best judgments that we can, and that is still the process that we're going through, in the same way that the SNP government in Scotland has recently opened up parts of the rules in terms of social distancing in Scotland. Despite the rising cases, we face a challenging decision ahead of the 21st of June, but that decision is made easier, and indeed the decision to open up is only possible because of the UK vaccination effort. And today marks 6 months to the day since Margaret Keenan was the first person in the world to receive a clinically validated vaccine in Coventry, the same day as Scotland, same day as Wales, and since then we've delivered 60...
Order. It's not a statement. It's an answer we require. Second question, Dr. Philippa Whitford.
I think the Secretary of State would find that most people in Scotland were rather glad that their NHS did not come under the Health and Social Care Act fragmentation of 2012. But having ignored the Scottish Government's call in February for all arrivals to undergo hotel quarantine, he then delayed adding India to the red list. This allowed the more infectious Delta variant, which one dose of the vaccine is less effective against, to enter and become dominant in the UK. Is he not concerned that if he removes all social distancing completely in the near future, this variant will cause a COVID surge among those who are not fully vaccinated?
Secretary of State.
As I was saying, Mr. Speaker...
Maybe not.
Touché, sir. Touché. In response to the question put by the Honourable Lady, what I'd say is this. The opening up and the return of our freedoms is only possible because of the UK vaccination effort. And in the 6 months to the day since we first vaccinated across these islands, yes, in Coventry, but also in Scotland, in Wales, in Northern Ireland, starting 6 months ago today. Since then, we've delivered 68 million vaccines across the whole UK. We've saved thousands of lives, and the whole of the United Kingdom has been set fair on the road to recovery thanks to the UK government's vaccination effort. I'm very grateful to everybody in Scotland, in Wales, in Northern Ireland and in England who's played their part in delivering it, and that shows the benefit of the United Kingdom Union saving lives, working together for everybody on these islands.
Substantive question to the Minister.